New York State Senate, January 26, 2016. Number of bills. The first bill, Senator Parker, 1068. Council?
This bill requires the Commissioner of Health to adopt, approve, and supply information to educate proprietors and employees of public eating establishments about the dangers of food allergens.
Discussion. Bill is moved. It's reported to Finance. Senate 1641.
This bans the sale, offering, giving, or distributing of powdered pure caffeine.
So moved.
Bill is discussion. Bill is reported to the floor. Senate 2198. Senator Carlucci.
This permits the OMIG to refer suspected fraud or criminality to a prosecutor of any competent jurisdiction.
Move it. Discussion. One without recommendation. Further discussion? The bill is reported. Senate 5458.
This requires healthcare professionals authorized to prescribe controlled substances to complete 3 hours prior to renewal of their registration of continuing medical education on pain management.
Okay, discussion?
So moved.
So, bill is moved. Any comments? Passed last year 59-3. Bill is reported to the floor. Senate 5077A, Croce.
This requires state recognition of the federally mandated DD Form 93.
Bill discussion. The bill is reported. Senate 5094A.
Directs Article 28, office-based surgery practices and healthcare providers to accept unscheduled walk-in appointments, to utilize electronic health records, and connect to the RIOs.
Discussion. Bill is reported. Senate 5458.
Create standards for the establishment and operation of limited service clinics within the space of retail business operations.
Discussion.
Discussion.
Just a little bit of discussion. This one has raised a lot of opposition from nurses associations, different organizations, about the fact that there is a major concern that retail or limited clinics of this type will enhance Walmarts and some of the others, but won't do anything really for continuum of care for patients. And I think it just ought to be examined some more.
Okay, this is reflection of what's been in the budget proposed by the governor. The
Governor's not a nurse or a practitioner. So.
no, but he does have a provision in there, and I presume we're doing this in order to set up the dialogue to see where we're going to get with this. The governor has a provision in there that the clinics be located in underserved areas, underserved health areas. So there is an acknowledgement that there's a concern and to try to address that. And I would imagine that to the extent we become successful in negotiating this, that type of concern would be adhered to.
It's for the needy people.
I can appreciate that. But again, in having conversations with people from the health industry, the location lends itself to a type of privatization that would be contraindicated to what the governor's intent is. And so I would hope that we would be able to really have a real discussion as a part of the health services as we get closer and closer to the budget.
Okay, and you're correct, but I also would point out that...
No, I'm just putting that on the record.
Okay, great. And I think that's quite legitimate.
Okay, great.
Senator.
I have similar concerns, not to belabor, but I assume that they could be for-profit establishments as well.
Yes.
Yes.
Most.
That doesn't make them bad.
Most retail stores are.
Many areas where, certainly in early intervention, where
Retail
for-profits do a great job.
Earlier, we just voted on a bill that I think puts one of the bigger requirements on the walk-in clinics, the urgent care clinics, which is that they be connected to the regional health information exchange.
Right, exactly.
So the records become part of a pattern.
Exactly.
I think-
And I don't think that this will do that, and that's a piece of my concern.
Okay.
That's what the negotiation requires.
Yeah.
Okay, sweetheart, but I just wanted you to know that I want to be part of the negotiations. Senator Larkin.
He hasn't been called sweetheart in a long time. All right, any further discussion? Got your comments on the record?
Just off the record.
Senator, off the record, on the record?
On the record and without record.
Without record, okay. All right, okay, the bill is reported to finance. We want to, without record?
No,
You're no, okay, excuse me.
unless you,
No, we're fine.
okay.
Thank you. Okay, it's reported to finance. Senate 5983, Senator Murphy.
This establishes standardized billing codes for mental health and substance abuse disorder services and provides for electronic payment of claims.
Move it.
Discussion? Bill is reported to the floor. Senate 6091A, Hannan.
Limit Schedule 1 or 3 controlled substance prescriptions issued upon initial consultation for acute pain to 3 to 10 days.
Discussion? Bill is reported. That's it, thank you very much.
Let 'em back.
Yes.